Selena says she still struggles mightily behind otherwise picture-perfect images. Medications to help treat her lupus caused weight gain, which she says fueled online criticism about her body.
Okay, listen, this is really important. So Selena Gomez, I believe, had lupus. Lupus led to renal failure. She ended up needing a kidney transplant. I do a lot of patients that need prolonged medications for these types of diseases. They take steroids, they take some sort of long-term anti-immune therapy, and it causes odd fat redistribution. Selena Gomez is a great example of both the negative and positive aspects of the social media, of people's access to information. Now, she's using it now to get the word out about how it's negatively affected her and how the bullying has made her really uncomfortable.
I would go online and I would post a picture of myself and I would say, it doesn't matter. All the while being in the room posting that, crying my eyes out because nobody deserves to hear those things. Though I was posting these things saying, it doesn't bother me because I didn't want it to bother other people who are experiencing the same thing, getting shamed for what they look like, who they are. I just think it's so unfair.
She has a medical problem. The fact that people are ragging on her for that, I think is horrible. I do a lot of patients, like I said, with PCOS, polycystic ovarian syndrome, with Graves' disease, with these medical conditions, or anybody who's on steroids from Crohn's disease, ulcerative colitis, any sort of autoimmune disease can lead to these aesthetic imperfections that really bothers people. And it kind of puts it on in a magnification in their own mind because they think people know that they're on these medications because they look a little bit different. So it's one of those things, if in the wrong hands, social media can be horribly destructive. In the right hands, it can really help people get the word out and feel like they have a community.
Celebrities absolutely can help change the culture. I don't think that people want perfection out of celebrities anymore. I think they want celebrities that they can see themselves in. If Selena Gomez goes through it and she has a bad day, I too can have a bad day because she's doing it in front of almost 400 million people every day.
They are driven to feel uncomfortable because of other people's bullying. I wholehearters agree. The body shaming is such a weird aspect of bullying these days, Selena Gomez, she had a kidney transplant. So she was on steroids for a long time because of the lupus. She was on it for the kidney transplant to kind of knock down her own immune system so that they don't reject the transplanted organ. I also do a lot of PCOS, polycystic ovarian syndrome. I do a lot of Graves' disease. So all of these things cause odd fat distribution within the head and neck and the rest of the body. Now, like Graves' disease, for instance, causes bulging of the orbital fat. It also causes pseudoherniation of the buccal fat. It's a really important thing many people don't know about. There's good literature on that. There's like a stigma to that. So back in the AIDS pandemic in the 80s, people, the AIDS medication really made people look quite cachectic, meaning their face really hollowed out. So Sculptra, Radiesse have programs for patients with AIDS that they pay for the product and we get to inject it for them. And now the new Ozempic face. So what is the Ozempic face? That's people that rapidly lose weight and then their face atrophies. So like the separation of the fat here, you see that fat pad separating. If I was to lose 50 pounds, quickly in 3-4 months, you would really think I looked odd. So that can be one thing that affects it.
Selena has long been outspoken about protecting her mental health.
One thing that Selena's really doing in this moment is normalizing her experience for a lot of other people. They're coming forward and sharing their experiences because of what Selena Gomez is talking about.
The star is one of many celebrities who've spoken out against body shaming.
It's like it doesn't matter how much positive energy you put into the world, you're still gonna have people who have something mean to say about you.
The mental health aspect of aesthetics, particularly facial aesthetics, is a complicating factor. It's probably one of the hardest things I do as a facial plastic surgeon. There's this body positivity side of what she's doing. Surprisingly, as a plastic surgeon, I really have a body positivity side. I mean, my goal is to make people happy, full stop. Whether it's putting their face back together after a trauma or changing something in themselves that makes them more confident and feel better. I always say, now, we could argue whether what I do should make people happier or not. That's a tough thing. That's the structure of society. I mean, I joke around that people like to be hot. I'm not saying she should do any plastic surgery or has done any plastic surgery. These surgeries make people confident, and if they can feel confident with it, I think it's the right thing to do. And if I can't make you happy, if you have unrealistic expectations, or if I really feel you're doing it for the wrong reasons, we won't do it. So you just got to be careful with that. You don't want to push these standards on anybody. At the same point, you don't want to stop people from getting happy. So if they can make a small change in their face or their body and it really makes them feel good, then I think it's important that they feel comfortable doing that if they can do it safely with somebody they trust.
Selena is not alone. A recent study found that teens and young adults who reduced their social media use by 50% for just a few weeks saw significant improvement in how they felt about both their weight and their overall appearance.
I haven't been on the internet in 4.5 years.
What does that do to detox your life?
It has changed my life completely. I am happier. I am more present. I connect more with people. It makes me feel normal.
Particularly these younger population, I mean, they really like to be on the social media, I honestly think, than more so than they like to be in the real world. It could be considered a bad thing, could be considered a good thing, depending on how you look at it. So, I think one cool thing is these mental health experts, people are able to do virtual consults and communicate with them. And sometimes people feel more comfortable in the virtual world, kind of sharing themselves and getting out there more than they would in person. So that's kind of a cool thing, I think, about the social media. But it's one of those definite double-edged swords where you got to be careful. And I advise every patient, get a second opinion. Just because it's out there doesn't mean it's true, right? You got to do your own research. You got to find people you trust and then still double check, look into it. The old fake news comment, I guess.
Like, subscribe, comment down below. Stay tuned for more plastic surgery, commentary, videos. You're going to just feel hotter.